Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you are just joining us, we are talking about kidney health. ExpressCare's Dr. Jitka Lom is with us in studio giving us some great information on the topic. And so in the beginning, we were talking a little bit about the purpose of the kidney and how you can tell if there's problems. And one of the things you mentioned was kidney stones. What are they? How do people get them? And how do you get rid of them?
Right. Well, kidney stones are accumulations of crystals. So in our blood, we should have very dilute, substances. And occasionally, if people accumulate, for example, uric acid, that's the one that also causes gout, or too much calcium, especially if they're drinking lots of tea and coffee and maybe not getting very hydrated, those substances will crystallize and create a tiny stone. The stones can be very, very small, like a piece of sand, or they can get huge, at least the size of sort of a pencil eraser, or even much bigger than that sometimes. And so they accumulate because, again, that coffee filter is not allowing them to come through because they're already too big for the holes in the filter. So that's how you get kidney stones. They tend to lodge in the upper part of the kidney, and then as the kidney is trying to flush them out, trying to push them through, they'll get stuck and start scratching the tube that comes from the kidney to the bladder. That's called the ureter. And as that stone is passing, it will hurt a lot. People compare it to having a baby.
It sounds very, very painful.
It is.
I've heard that's the closest that men will get to knowing what it's like to have a baby. So the biggest thing is, how do you prevent them? You mentioned tea and coffee. Yes. And not staying hydrated.
There are 4 different kinds of kidney stones, and you can find out what kind you have by checking the urine through a lab test and also catching your kidney stones. If you know that you get them, you can use an actual filter and catch your stones, and then they can be sent to the lab and analyzed, and you can find out which of the 4 types you have. Sometimes they're mixed types too. And then your doctor can help you with diet advice and sometimes with medication to prevent them. So for example, with uric acid stones, we want to cut back on our meat, stay hydrated, don't eat any of the things that cause gout because they'll also cause kidney stones.
So we mentioned earlier about the high blood pressure and then people having issues with their having kidney disease, and we see so many of these dialysis centers popping up. We have one right next to the studio. And so what does the kidney, or how bad do things need to be for somebody to have to go through dialysis? Because you see these places are constantly busy with people.
They are, which is very tragic. So the way that we measure the kidney, we mentioned the urine to see if there's protein in the urine, and we also do blood tests. And there's 2 blood tests that you may be familiar with or might have heard. BUN and creatinine. The BUN stands for blood, urea, and nitrogen. These are waste products that the urine should be, or that the kidney should be filtering out in the urine. If they're not filtering and they're staying in the blood, it's going to make you very, very sick. And that's why people that have end-stage kidney disease are very tired. They have that yellow, discolored looking skin, very sort of mentally confused sometimes. This is because of the waste products. And the creatinine, that is a muscle breakdown waste product. So again, those numbers should be very low, right? Because we want very little waste in our blood and lots in our urine. So we measure it, and we also measure how well is the kidney filtering, and we call that the glomerular filtration rate, GFR for short. Anyway, this is done with the lab, and we measure it. Basically, the best one is healthy kidney, and the worst one is a stage 5 end-stage kidney, basically not working at all and not producing any urine. In between that, you have different levels and grades, and that's why it's really important if you have diabetes or high blood pressure that at least once a year, but more than that usually, but at least once a year you get your urine checked and your blood checked to see what is the state of your kidneys. And then your doctor can tell you, okay, well, you got about 50% of your kidneys shot. You need to take great care with your kidneys. These are the medicines you need. This is the diet you need to do so that you can care for those kidneys. The sad part is when people when I hear this story of like everything was fine till I got on that blood pressure medicine and then I ended up on dialysis. And that's because for so long they hadn't cared for their high blood pressure. They didn't know that they had kidney disease, and they were already in stage 4, moving on to stage 5 and needing dialysis.
So the biggest thing when we talk about most most of the topics that you come on board for, we talk about prevention and prevention being key. And so for those people out there who may not have high blood, or maybe they do, how can people protect their kidneys and take care of them?
Yes. Well, through the awareness first. If you have a family history of diabetes, high blood pressure, or somebody in your family's on dialysis, or other diseases, for example, lupus, or you talked about infections. If you keep getting infections, bladder infections, or kidney infections, these are all risks for your kidney down the road. So again, you would need a checkup, not all the time, but once a year, get a urine test. That's a very simple and cheap test. It will cost you under $20 to have your urine run by a lab to see if it's healthy. And then control your blood pressure, know the numbers, 120/80. So often I'll see patients who are like, well, I run in 170. This is not okay. You need to take that down. And by national guidelines, probably 2/3 of patients will need 2 drugs or more to control their blood pressure. Many people are on one or a low dose of one and say, I'm taking blood pressure medicine, it's not working, but that's because you're not taking enough. So knowing that you need to control your blood pressure, knowing that you also need to control your blood sugar, those are the top 2 to help your kidneys be very healthy and so that you can stay far away from dialysis.
Okay, and real fast before we throw to the break, what are some kidney healthy foods? Because I've read that there are things that can actually help
your kidneys. Well, water, okay, that's the one that helps the most of all. But as far as diet before dialysis, we want to have patients, if they already have an impaired kidney, you think, okay, it's a coffee filter, I don't want to put too much protein in there because it'll have to work harder. So in the stages prior to dialysis, we want patients with kidney problems on a low protein diet. And a nutritionist can help with that, or you can go online and learn more about it. But basically it's a low meat diet. As far as if they are already on dialysis, they need, again, more specialized advice, but they actually need a high protein diet because they're so sick and they'll keep getting thinner and thinner and wasting and getting sicker and sicker, so they actually need a high protein diet at that time.
So it varies depending on the stage.
It varies on the stage.
But prevention is obviously the most important.
Yes.
Well, thanks, Doc, for coming in. We always do appreciate it. Dr. Lom will be back again next week when we will be talking about iron, the highs and lows. Send us your questions at healthyliving@kuem.com. We are back to wrap up the show right after this.